So I think there could be many different things that we can offer for the patient, but I think as a whole, often say, for example, we start with the breast. The patient might often come in with a fairly deflated breast, but a lot of the issues are not so much the volume, but just the skin excess. So often in those patients, the goal will be to try and do what we call the mastopexy, which is really just a lifting process rather than actually reducing any of the actual native breast volume. I think patients often talk about, whether or not they need additional volume with implants or other procedures, but I generally would sort of encourage patients to simply go through a reshaping, because you'll be amazed how much the reshaping itself can actually improve the overall aesthetic of the breast without adding the burden of the implant, which is obviously not a permanent prosthesis and require multiple sort of procedures down the track for revision. And if there is some additional requirement for additional volume, that can actually be quite well addressed with some fat grafting, which is a much more natural processes as well. And there's none of that side effect associated with the implant. So that's what I'll generally recommend patients to consider for the breast. For the abdomen is quite a different story. Like again, it depends on whether there's multiple rolls, whether there's any vertical or horizontal laxity, whether that laxity kind of goes to the back in terms of whether it's the upper back or lower back as well. But I think the main thing is often just addressing that central vertical laxity as well as the horizontal laxity with a fairly standard abdominoplasty to begin with, and hopefully that often will manage to address, I say, a significant portion of the patient, or at least a patient who come to see me wanting to have an abdominoplasty for that procedure. Obviously, every now and then we do combine it into a circumferential lipectomy, which is basically extending all the way around to the lower back to address that laxity as well. But I think. Again, I probably say the majority will probably start up with an abdominoplasty just for that purpose of reducing that central abdominal pannus. Then, often we may talk about, the arms or the thighs as well, which is again another area that patients quite commonly concerned about. So in terms of the arms, that will often involve removing that excess skin that were hanging in the medial aspect of the inner aspect of the arm. Sometimes there may be some extension that needs to go onto the side of the armpit as well as the chest wall as well, and depending on what the breast looks like, that might blend in with some of the chest scar as well. In terms of the thigh, then often it's addressing that sort of inner thigh laxity in the vertical as well as the horizontal component, but really it's just trying to give that lift and then try to narrow down the circumference as well, just so that they don't have that constant rubbing in the thigh. As I mentioned, there are other things that, in terms of what we call upper back lift, or sometimes people talk about a reverse abdominoplasty, specifically addressing that upper abdomen laxity as well, that may be added as a later on procedure. But I think the reality is really just sitting down, identifying where the excess skin is, identifying which is the area that bothers the patient the most, and then we can really formulate the sorts of steps in order to achieve that result.